From the beginning. Righty. Hopefully you all can see the presentation.
Yes.
Perfect. Alrighty. So I want to thank everyone for joining us today to talk about the Susan G. Komen Pennsylvania More Than Pink Walk. We appreciate you joining us on your lunch break for our monthly webinar. In honor of Black History Month, we'll be focusing on how Komen is advancing health equity and how you can make an impact by joining the Pennsylvania Walk at either Shenley Park in Pittsburgh, Parks Casino in Bensalem, or virtually. So I'm Chelsea Beecher. I'm the Development Director for New Jersey and Pennsylvania, and I'm joined by my colleagues Molly.
Hi, I'm Molly Sweet from Pittsburgh.
And Taylor.
I'm Taylor Kozuk. I'm the Development Specialist for New Jersey and Pennsylvania. And I'm in Philly, so I don't have rain yet for everybody in Pittsburgh.
slowly coming our way.
Slowly.
So today we'll be sharing mission updates with the focus on health equity, talking about the Pennsylvania More Than Pink Walks, providing some event details, sharing what's new, how you can get started, exploring your fundraising center and the great updates and enhancements for the center itself on the desktop and also the mobile app. And hopefully, if we have time at the end, we'll answer questions. However, Taylor, Molly, and I are always available for you to reach out. We'll share our contact information and be happy to talk to you about how you want to get involved or your company, whether that's through volunteering, sponsoring, starting a team, or just learning more about all the great work that Komen is doing. So to start off by just sharing our mission with you, our mission is to save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. We have some strategic priorities, to being conquering metastatic stage 4 breast cancer and eliminating breast cancer disparities. So today we're coming together to talk about what these breast cancer disparities are, how they're jeopardizing our communities, and our vision of a world without breast cancer, and hopefully, what you can do to start a team and sign up and really help us change these really startling statistics. One being that Black women are about 40% more likely to die of breast cancer than their white counterparts. We're going to talk more about our Stand for Her health equity revolution. And then, of course, overcoming these other startling statistics around 1 in 3 Hispanic women report having no personal doctor and are more likely to be diagnosed with breast cancer at a later stage. Only 30% of uninsured women are up to date with their breast cancer screening. And shockingly, even compared to 64% of insured women. So, spreading more awareness about getting those screenings. And then more than 50% of women delay or avoid breast cancer care because of the cost, choosing to prioritize their families and children over their own health. So what is Komen doing about this? We're working to achieve health equity by removing barriers to care. We're focusing on populations disproportionately affected by breast cancer and driving systems change. This is a really great visual representation of equality versus equity versus social justice. Susan G. Komen is hoping to fall on this right side of the photo, not assuming that everyone benefits from the same support, but really addressing, removing those systemic barriers so that everyone gets higher quality of care, no matter who you are, no matter where you live. So one initiative that we're really proud of that's new, and you probably have been receiving, hopefully, if you're on our emails, lots of information about it. It's called Stand for Her, a Health Equity Revolution, HER. This is a special initiative focused on the Black community. We're aiming to reduce breast cancer disparities in the Black community by 25%. So what Komen has done is launched a 2-year research study. So we've completed this research portion of the project, and essentially we looked at the entire country and we wanted to know where late stage diagnosis and mortality disparities in the Black community were the greatest. So we've identified 10 cities You can see them listed here, but see Philadelphia glaringly right there in the top 10. And we hope, through our Pennsylvania More Than Pink Walk, we could spread more education and awareness in the community. So, we're happy to share this report finding with you via email. You can also find it on our website, but we're proud to be moving beyond the research phase and now into the action phase in terms of saving lives through empowering the public with education, connecting people to timely, high quality care, developing the next generation of diverse healthcare leaders, sparking discovery through representation and diversity in research and clinical trials, and giving a voice to all breast cancer patients in policy development. And I'm going to talk more about each of these bullets in the next few slides. So in terms of education, thank you for joining us this February in honor of Black History Month. We launched a very special health equity website dedicated to our efforts, and you'll see one of our campaigns, Know Your History, Know Your Risk. As we know, everyone's at risk for breast cancer, but some of us are at higher risk than others, and we want to change that. So we're encouraging this month to have a conversation with your family members on both sides about breast cancer, but also other health issues to understand what you can do to take action and find preventative measures that work for you personally. We know, however, that the two most significant risk factors for getting breast cancer are being born female and getting older. So, unfortunately, if you were born female and you're getting older, you are at risk of breast cancer. However, it's best to know your family history to see if you are even at higher risk. So how are we spreading this information? These are a bunch of tools and resources that your company or you can download on our health equity website. And Taylor, Molly, and I can also work with your company to get information out through Lunch and Learns such as this, if you start a team or sponsor the More Than Pink Walk. But we have educational resources in terms of flyer and information that we're disseminating. We really try to work with companies, large or small, because it helps us get more reach and be able to educate more people, provide our tools and resources, and get life-saving information into the hands of those that need it. Through this health equity toolkit, there's even social posts that your company can use, or you yourself personally. There's even a 15-minute breast health presentation that can be played as well. So there's lots of different ways you can educate through communications and downloads and such. So if you do go ahead and download these resources, some of the messaging you might find are around our 4 self-awareness messages on knowing your risk, getting screened, knowing you're normal, and leading a healthy lifestyle. So that's really around our sort of education component, empowering the public with education. And then in terms of getting people connected to timely, high quality care, we do have our 1-877 Go Komen helpline, which, if you call or email the helpline, there are trained Komen oncology and social workers on the other end to answer your questions, direct you to local or national resources, can help navigate clinical trials, provide emotional support, and even direct to our Komen Treatment Assistance Program, which provides financial assistance to lower income patients currently in treatment to help with basic needs. We know that, families are first focus for lots. Moms will often put their family first and ahead of their own health. And we don't want a utility bill, a rent bill standing in front of someone's treatment and getting them better. So if you are a breast cancer patient with an active stage 0 to 3 diagnosis, you could apply and receive $500 in funds or $750 for stage 4 metastatic breast cancer to use towards housing, utilities, transportation, to treatment, food, medications, childcare, elder care. However, that money can help you get the care that you need. So We've seen an increased demand over the past few years. Most of the requests are for housing and food insecurity. And we expect to provide about $3.5 million worth of awards by the end of March, which, we're really happy to be able to get into the hands of people. We've launched a Worship in Pink program to provide education and these resources to religious organizations as well. And we've developed a patient navigator program to train Black patient navigators to work with Black patients. And this is an effort to not only enhance their career path and produce higher income potential, but in the research study that I talked about earlier, Philadelphia was found, it was found that many survivors characterized the care they received as inefficient, inaccessible, and lacking empathy. Instances of racism, microaggressions, and healthcare discrimination cause widespread distrust. So in order to build more trust, we hope that by the end of 2022, we'll be able to train 200 Black navigators. And we had our first class graduate, which we're happy about, which is a really great opportunity and something that we created along with the George Washington University Cancer Institute of Oncology. And Komen, however, produced a first of its kind module on navigating racism and bias for Black patients in the healthcare system. So we're doing a lot to try to take action on the Stand for Her initiative, including our advocacy efforts as that sort of last bullet on policy development. So we encourage you to sign up if you are not already to become an advocacy insider and help us push forward policies that will better affect people with breast cancer. And what you might receive if you sign up is, for instance, Komen sends these really great already drafted templates that you just put your name in and send right off to your local lawmaker to be able to advocate for things such as access to the Breast Cancer Diagnosis Act. And if you sign up, I encourage you to explore the other policies on the site as well. So that was sort of our mission overview and health equity focus for today's monthly webinar topic. And we hope that you will make an impact through the More Than Pink Walk by, like I said, starting a team, sponsoring, just, getting your friends and family involved, your employees, and really sharing all of the great work that Komen is doing, the tools, resources, education that might save someone's life. And you can do that essentially for free by starting a team. It's free to register, and Molly and Taylor are going to talk more about how you can make an impact. Molly?
Hi, good afternoon. My name is Molly Sweet, and I'm development manager for the western side of the state, and I am right here in Pittsburgh, Pennsylvania. So excited that we're finally going to be activating live for the first time in 3 years. It's actually in Pittsburgh, the 30th anniversary of Komen. It's Komen's 40th birthday, but 30th for Pittsburgh. And we're psyched to say that we're hosting our live activation in conjunction on the same day with Philadelphia. We will be hosting the Walk in Pittsburgh in the traditional spot on Mother's Day at Shenley Park. And Taylor is going to share the new location for the Philadelphia.
And we are excited to share that we will be at Parks Casino in Bensalem. So right outside of Philadelphia for our new location. It's going to be on the horse track. It's going to be fun, family-friendly fun on Mother's Day. Go ahead.
So the More Than Pink Walk, first and foremost, this event is what was used to be known as formerly as the Race for the Cure. And it's more than just a walk, it's many things. Not only is it our largest educational and fundraising event every year, more importantly, it helps us bring together the community to remind us that we're not alone and that we are united in the commitment to fight this devastating disease. So everyone wants to know what's new. What's new with the More Than Pink walk this year that's different from the Race for the Cure? First of all, as I've already mentioned, we're back in person, but I don't want to be remiss in not mentioning that we also have a fully virtual component that is an option. So when you go onto the website to register for your team, there's also a virtual choice. You can walk where you are, and that has a full program that goes along with it. So you won't be completely on your own, but that is another option. So we're back in person. As Chelsea already mentioned, there are no registration fees. It's free to register, which makes it inclusive for all. We have a lovely upgraded fundraising center, and we're going to be talking a little bit about that in a moment. There's a new incentive prizes that I'm going to show you a few of. And to earn your t-shirt, all you need to do is fundraise just $100. So for getting started, it's just as easy as really 1, 2, 3. You register, you recruit your team members, your family members, your coworkers, your friends, and you start fundraising. We offer many tools to help you with this along the way, from doing a fundraise 101 for your organization, or even just fundraising tools and guides that we can send your way for community teams. What is the number one reason that people donate? This is a quiz. Is it A, that they're connected to the cause, B, because someone asked them, or C, they feel good about donating? Most people would be surprised to find out that the answer is B. Fundraising is intimidating to many folks, but really everyone that loves you loves what you care about. And so that's just a fun little slide I'd like to include. So we want to put the fun in fundraising. I know that sounds silly, but it's true. And there's lots of ways we can do that. There's many suggestions. Here are some right here on our, I always suggest that you start with the self-donation. When you register, you'll see it's very easy to connect to Facebook, and there are metrics that show that there's a significant increase in donations when you connect it to your personal Facebook. And then there's all sorts of ways to fundraise. So I always say to keep it close to the heart, things that are around you, people and opportunities that you have. It can be as simple as cleaning out your closet, selling some items online, challenging your friends, to $10, 10 friends, get your t-shirt. And there's, like I mentioned before, many other suggestions to go along the way. Walk day shirts. It's all about the shirt. I want to stress that as before, all survivors and thrivers will receive a free survivor shirt, no matter what their fundraising status is. As I've mentioned, all other folks need to raise $100 to receive their shirt. So we have some new individual fundraising prizes. So the first prize, the image isn't there yet, but it's going to be a bracelet, and it's to show that you're an early fundraiser, that you've raised your money 5 weeks out, at least $100 5 weeks out, which I've done the math is April 3rd. A lot of folks like to set their goals, which you can also set on your own, right in your fundraising center. Many folks like to set their goals based on the prize that they would like. So these are the prizes that have been rolled out for this year, and that does motivate many folks to get involved. Now, I believe we're on the slide with the Fundraising Center, and I think Taylor is going to show us some of the things that are new on it.
Thank you, Molly. So yeah, our personal fundraising center is new and improved, and you can use this fundraising center to share your fundraiser on your Facebook page, which will bring in, oh man, I forget the amount now. I think it's 10 times more donations if you share on your Facebook page. Send donation request emails to all your friends, your family, your coworkers, your boss, make them open their wallets a little bit. Contact your team members. Sometimes it's hard if you don't have everybody's phone numbers or emails, but this is one way you can contact them. You can change your fundraising goal once you already accomplished your original goal. You can go ahead and up it. Collect badges. So if you're competitive like I am and you're trying to have a competition with someone to see who can collect the most badges, this is a fun way to do it. You can also edit your personal page and include your story in a photo. So if you have if you've been diagnosed with breast cancer, or your family member or someone very close with you has been diagnosed, feel free to edit your story and share that. People will they will understand your story based off of that. You can also download the app. So if you're like me and you're not on your computer ever except for work, you can download the app and do everything that I just mentioned on your phone. I believe you can also track your steps. So if you have a competition of who can get the most steps in, go ahead and download the app and see if you can do it that way.
Another really great feature of the app is that you could deposit checks. So, you know, lots of my like my aunt and the older people in my family will hand me all these checks, and I'll be able to deposit them right through the app. And then you can also connect to Facebook as well. So it's a really great tool right at your fingertips to try to make it easier for you to collect your donations and share your story and celebrate all your progress.
It's also a fun way because if you get a big donation and you hit 50% of your goal, you get a notification saying you're halfway there or you're 3/4 of the way there. So I find it to be fun to use the app. And if you haven't already, please join our Facebook group, our Komen, Pennsylvania Facebook group, and you'll receive updates and talk to other walkers, learn more about our mission, resources, and any walk day updates.
So we want to recruit teams. Teams are the key to success and the core of the More Than Pink Walk. The more the merrier, right? So it's very simple. Excuse me. Start a list of people that you know and have a connection to breast cancer or care about you and want to support what you support. Send an email with a link to register to all prospective team members. We're here to help you with that, with creating links, QR codes, anything that you need to help you out. Shout out to the team through the social media, tell friends and family that you're walking, and participate on all social media to spread the word. This is a slide in the fall, we had one live event in New Jersey, which was the More Than Pink Walk. And here are some pictures from that where you can see how exciting it is to all be gathered together again. And these are some of our pillar sponsors, our four core pillars that Chelsea's talked about before were represented in the program. But you can see the excitement and everyone was so excited to get back together again. We would also like to thank you, all of our sponsors, for sponsoring us for this program. And if anyone is interested in having their company participate, we are always here to talk about that. And we're looking to add more sponsors before the walk kicks off. Our next webinar, we're hosting monthly webinars with a different message for each one and more information on the More Than Pink Walk. Our next webinar will be on March 9th at a slightly different time, 2 p.m., still a half hour. You can register the same as before. Here is a scan code to do so as well and a link. In our next webinar, the topic will be employee engagement and team building. We're hoping to attract some corporate teams. Again, still free to register. And if you get a nice size corporate team, we're happy to help you with the Fundraising 101 webinar or anything to get you going. And we'll talk more about that next month at that webinar.
I also wanted to invite you all to save the date for a couple of our free to attend breast cancer education series presented by our partners, Penn Medicine, on March 23rd at 5 p.m. We'll have some healthcare professionals addressing personal risk and racial disparities. And then also our other wonderful partner, Geisinger, on April 5th at 5 p.m. To learn what does it mean to be high risk. Those will both be free. Molly and Taylor will be in touch with the event links to RSVP once they become available. So that's the end of our monthly webinar. We have about 5 minutes left actually for questions. If anyone has any or thoughts, comments, ideas, anything you want to share. Of course, we'll send out an email afterwards with the links that we shared in the chat today, and then some other resources that we'd love to provide you and as well. And then of course our contact information is right here, but you'll have that as well in the email, so you can reach out to us anytime with any questions or any thoughts. Thank you.